So I think we're going to get started. Just a brief introductions first. My name is Olivier Mills. I'm with CAWST, the Center for Affordable Water and Sanitation Technology. There are three of us hosting this webinar today. Also online, I will let them present themselves.
Hi everyone, I'm Sian White. I'm based at the London School for Hygiene and Tropical Medicine, and I'm the lead researcher on the WashEm project.
Afternoon everyone, my name is Tom Heath. I'm ACF Technical Wash Advisor, and my role in the project has been an operational focal.
Okay, so just to do some logistics first around the webinar. Go to next slide. So at the bottom of your screen, you should see a chat button, a raise hand button, or a Q&A. Depending on what device you use, if you're using a mobile device, it might be at the top. What we're mostly going to be using today is the Q&A button. That one will allow you to, at any point in time during the webinar, ask a question. So just click on that button, and then you'll see the opportunity to type in your questions and see the questions that you've already potentially asked. The way it'll work is that at any point in time, just type in your question, they will all line up, and we'll have moments during the webinar to address those questions. We will address them either in writing that everyone can see, or we'll speak to them verbally. The chat button will just allow you to say hi. I see some people who already said hi from the different places. That's great. And so if you do have a question though, please use the Q&A so that we can properly moderate those questions as well. And that's it, I think, from the logistics of it. We are recording this video, so you will be able to view it later as well. We'll send out an email after the webinar, probably tomorrow. I'll hand it over now to Sean, who'll be presenting the rest.
Great, thanks very much, Olivier, and good morning or good afternoon or whatever time of the day it is wherever you're joining us from. As I said, my name is Sian, and in today's webinar session, we're going to cover four main things. So firstly, I'm going to explain to you what WashEm is and why you might need it. And so for some of you, this might actually be quite familiar territory if you've been with us on the WashEm journey so far, but for others it might be entirely new, so do bear with us as we bring everyone up to speed. We're then going to move on to the key focus of this webinar, which is showcasing the new WashEm software. And I'm going to take you through the software, explain its key features, and show you how it is used. And then we're going to hand over to Tom Heath from Action Control FM, and he's going to explain us a case study of using the WashEm process in Nigeria. Lastly, we're going to wrap up with some points about why you might want to use WashEm and reflections on the approach. So that's what we have planned.
So we're just going to undo the videos so that you guys have a better.
Great. Bye, everyone. Okay, so let us tell you, firstly, before we get started, a little bit about who the WashEm team are. So I know that when you look at perhaps the WashEm website, or you look at the software, or you interact with a webinar like this, it can all seem a little bit impersonal, and that's really not how we want to come across. We're really keen to connect with you and learn from you about how we can improve the WashEm process. So on this slide, we've got lots of our friendly faces. And while the WashEm process is being formally launched today, it's actually taken us 3 years to get to this point. And we've been bringing together the diverse experience of 4 different organizations, specifically Action Control FM, CAWST, the London School of Hygiene and Tropical Medicine, and our donor, USAID After. So in all, we're actually about 20 people. We work all across the world in different locations, across 7 time zones, in order to bring WashEm to life. So if you have questions today, or a week from now, or 6 months from now, please do drop us a line. We'll always be happy to help. So that's quite enough about us. We're keen to know who's joining us on the line. So we're now going to open up our first poll of the day so that you can let us know who you are. And we have 5 options for you to choose from. And so I just want to explain how we're defining these here. So if you're a WASH advisor, we're kind of assuming that you're the type of person who works at your organizational headquarters and probably supports multiple country programs. Whereas if you are a WASH program manager, then you're probably supporting, you're probably based in a crisis affected country or a crisis prone region and designing programs in that context. Or if you're a hygiene promoter or WASH engineer, you're the people on the front line. You're directly interacting with crisis affected populations. The 4th point is if you're a person doing research on WASH or behavior change, or perhaps you're someone else joining us. Do let us know in the poll.
So you should see a window pop up. Please click on the button and submit. The polls are running in. It's very exciting. We have over 100 people online here, so lots of votes. So just click on the screen, the button that shows up. I'm going to end the poll, and so that we can have a look at the mix of people that we have here online.
Okay, so if I'm to look at this graph, hopefully you can see the results too.
Yep.
We've
Yes.
quite a lot of people who are working at that high headquarters level, about 41% of the people online. But we've also got some people who are more local level program managers and hygiene promoters. We've got not so many behavior change researchers, and I think I'm one of those. So, so not so many of that target audience, and lots of other people. So do tell us in the chat what your role is and how you think WashEm might be able to support you. So thanks very much for that. Let's move on. Oops. Okay. So we want to begin by asking this big question. Why do we in fact need to become better at designing hand washing behavior change programs? And this is really the key question that WashEm seeks to answer. WashEm is all about designing rapid, evidence-based, and context-specific hand-washing behavior change programs in emergencies. And let's just quickly remind ourselves why this is necessary. So as WASH professionals, I'm sure you're all more than familiar with the problem that we are primarily trying to address in crises, and that is that crises create this kind of perfect storm of conditions that allow the spread of diarrheal diseases. So we know that in crises, 40% of all mortality is due to diarrhea, and that things like respiratory infections also increase by about 30%. Of course, this effect is even more pronounced among children under the age of 5. So you may have seen this recent fact from the Water Under Fire report that found that in conflicts, children in this age group were 20 times more likely to die from diarrhea than from violence itself related to conflict. And as WASH professionals, I'm sure that you all know that hand washing really remains our best defense in curbing the spread of disease. Hand washing with soap can potentially cut diarrheal disease by almost half and reduce respiratory infections by almost a quarter. But at the moment, most hand washing programs in emergencies consist of 2 main things: the distribution of hygiene kits and hygiene education, which typically involves just explaining the public health benefits of hand washing. Now, of course, being informed and having access to soap and water is important, but these 2 things alone have typically not been sufficient to result in meaningful behavior change in crises. So over the last few years, I have interviewed and worked with hundreds of humanitarians working in different settings and in different emergencies. And I've been trying to understand from them what are the challenges that make hand washing promotion so difficult in these circumstances. So I want to take a moment here to share some of the insights that they have shared with me. And in a moment, we're going to take a second poll so that you can vote and express whether you have faced similar challenges in the areas where you work. So let me share with you some of these reflections. The first point is that obviously in emergencies, we're working in situations where we need to act urgently and quickly. And as a result, our proposals, which lay out the design of our programs, are put together really quickly, often by just 1 or 2 people and with little consideration for the local context. The other thing is that we are getting better at taking time to understand our populations. We commonly do knowledge, attitudes, and practices surveys or other types of assessments. But the problem with these tools is that they typically take a lot of time and they're quite heavy in terms of staffing and financial resources. What results is that we often get the results just a bit too late. And so you might get the results 2 months into your program, and then you can't really use the results to influence your program or change the activities that you need to do. The third point down is that it's quite hard for humanitarian WASH actors to stay on top of the evidence around what works to change behavior. Even if you do have access to that evidence, to understand how to adapt that evidence and apply it. Possibly many of you can relate to is that hygiene promotion is always the underdog of WASH. It's always receiving less funding and less time allocation than the bigger elements such as water and sanitation. And we probably also know that if a part of the budget needs to be cut, it often comes from the hygiene promotion budget. The next one is that there typically is a lot of knowledge around hand washing behavior. In most cultures, people know the right thing to do, but we often observe this gap between knowledge and practice, and this can be frustrating and hard for us to overcome. So we're now going to open the poll. Maybe you've experienced some of these specific challenges, or maybe you can actually relate to all of them. We'd love to hear your thoughts.
So you can click more than one option before you submit. So for those who've just joined us, welcome. We're just launching a poll here. You can click on your screen. You can select more than one option before you submit. Okay, get your votes in. We're just about to close.
Okay, so looking here at the results, it seems like many of you have faced similar challenges in the work that you're doing. In particular, the one that got the most votes is this last point about the challenge of overcoming the gap between our populations knowing the right thing to do and actually doing the desired behavior. So I want to also thank you for your honesty in this poll, because sometimes it's a difficult process to create a space where it's okay to talk about the challenges and limitations of our programming. And this really forms the ideal stepping stone to making a commitment to trying to do programs better in the future. So if we exit that poll and keep going, so WashEm is really all about helping you to design better programs. So let's jump right in. So the research that we have done with humanitarians and among crisis-affected populations over the last 3 years has told us that whatever the solution we designed, it had to meet these 5 criteria if it was going to be useful and used by humanitarians themselves. So the first thing we realized from our research was that for many WASH practitioners, they think of hygiene behavior change as a specialized skill. And we want to change this. We want to help humanitarians feel able to do hygiene behavior change and feel like it's something that is part of everyone's job. We also knew that we would have to develop a process that would allow hygiene programs to be designed rapidly. Now, at the moment, if we look at behavior change theories that are commonly applied in low and middle income countries in stable settings, we often see program design processes that are almost a year long. And these become completely irrelevant for us to consider if we can adapt and apply them in emergencies. Instead, we need a different process that's much quicker. The third point is that we wanted to develop hygiene programs that were based on evidence, but that didn't necessarily overwhelm humanitarians with evidence that they couldn't process at a time which was very stressful and where they needed to act quickly. The fourth point is that we wanted to develop hygiene programs that are context specific. As we know, humanitarian crises can affect all countries, and so we assumed from the outset that one size would not fit all. The last point is that we wanted to develop hygiene programs that were sensitive to the needs of vulnerable crisis-affected populations. And I think this is a particularly important point because sometimes it's easy for us to forget that for the populations who are affected by a crisis, it's probably one of the worst points of their lives. All that they are familiar with has just fallen apart. And we need to make sure that our hand washing programs are designed in that broader context and that we don't unintentionally cause any harm or offend people in our hygiene promotion. So what is WashEm? Well, WashEm is a program design process which involves 4 simple steps. The first thing you need to do is to log on to our website. Here you'll find the tools and the software. Here you can also find out about the WashEm rapid assessment tools and the learning materials. The second step is to use the rapid assessment tools to collect data in the context where you're working. And once you have returned to the office, you will open the WashEm Program Designer software and you'll enter your results. At the end, you will press Generate Recommendations and get a set of contextualized hand washing promotion activities. So that's how simple it sounds. What we have found with our experience so far, that WashEm typically allows people to design innovative, evidence-based and contextualized programs in just a week. So this makes it feasible even in the more acute phase of a crisis. Now, I am going to quickly go through steps 1 and 2, but today's webinar will primarily focus on steps 3 and 4 because this is really the new part of what we are launching today. But for those of you who are new to the WashEm process, let me take just a few moments to explain a little bit more about these rapid assessment tools. And if you have used the rapid assessment tools before, do stay tuned because in this new release, there's quite a lot of new resources to support your learning and use. So what are the rapid assessment tools? Well, there are 5 of them. Each one is a different method for exploring the determinants of hand washing behaviour. They are designed to generate the kinds of data that is needed to influence program design. And they're also designed to be easy enough for anyone to learn. So you do not need to know anything about behaviour change or even about WASH in order to do these tools. And from our experience so far, normally it takes about 1 to 2 days to learn about the tools, practice them in a sort of office environment in a safe space, and then to be able to go out to your crisis-affected population and collect the data. And this typically takes 1 to 2 days to conduct. So as you can see, it's quite a rapid process. The rapid assessment tools were released just over a year ago, and since then we have been able to use them with our partner organizations in 34 different humanitarian emergencies. So they've actually been used in the early stages of cholera outbreaks and to prevent the spread of Ebola, for example. They've also been used in disasters such as typhoon response, flooding, and drought. And they've been used in conflict-affected areas, both in acute and protracted situations, and both with refugees and displaced people living either in informal settings or urban settings and in camps. So here on the map, you can see the orange dots relate to where WashEm has already been used, and the blue indicate planned use. You can see on this slide who has been involved in testing the WashEm tools so far. It's been used by 45 different humanitarian organizations, UN agencies or government bodies. And several of these organizations have already started to make changes internally so that WashEm can be part of their standard operational procedure in relation to behavior change in crises. The WashEm rapid assessment tools are easy to use, I promise, but they do differ from standard tools that are typically used by the WASH sector as part of humanitarian response. And so what we typically see is that there's quite a steep initial learning curve. And so to support you through this learning process, we've developed a range of materials to provide assistance. So primarily these are targeted at WASH program managers in country. And the idea is that they can use this training package, which has lesson plans, it has activities to aid learning, and it has a slide deck with lots of examples, and they can use this package to train their teams who will be involved in the data collection in their context. In this new release, you'll also find video guides for each one of the 5 rapid assessment tools. And the idea behind these videos is that they complement the learning package and they give you a sense of what each method looks like when you're actually doing it in practice and what the key steps are that you need to follow. If you're still feeling a little bit unsure or don't know quite what to expect from the WashEm process, then you can also check out our website where we have some video-based and written case studies. And this is where you can learn more from other organizations who've used the tools and have shared a little bit about their experiences. So we're now that I have kind of covered off sort of step 1 and 2, I wanted to just kind of let you know, if you have more questions about those, probably your first point of call will be to visit the WashEm website. This is where you can find those rapid assessment guides. You can also try watching our previous webinar, which again you can find on our website. And that actually explains one by one how each of the rapid assessment tools work. But I first wanted to just quickly pause in case there were any questions at this point about either the rapid assessment tools or the learning materials that support those. If you have broader questions, we'll come to those later at the end of the webinar.
So we've had one question that I've answered online, but I think worth saying verbally. One question was if there was a cost in using any of these tools, and the answer was no, that all of it is available for free. We have a couple questions coming up here, and I will let Sean answer them. The first one is from Jean McCluskey, is how do the people train their teams, I think is the question. How will they train their teams?
Right, well, thanks for that question, Jean. So the training package, it's available online on the website. If you download that, it kind of gives you all of the materials you'll need. So it will tell you how to prepare for the training. It will give you the worksheets and the activities. You'll find each of the lesson plans, and you'll also find a slide deck, which is annotated so that you know what to say. So the idea here is that we want to avoid needing, expensive consultants, and instead this is a package which is designed for WASH program managers to be able to train their teams.
Okay, great. Another question is, what languages are the tools available in?
Great question. So currently all of the rapid assessment tool guides are available in English, French, and Spanish, and in the coming weeks we will be releasing an Arabic version. We will also soon be releasing versions of the training package in French and Spanish.
Okay. There is a question, the language we answered. Are these tools designed for any contexts? What are the limitations?
So these tools are designed to be used in humanitarian contexts, and as I explained, they have been used in all types of humanitarian contexts, from outbreaks to armed conflicts and disasters. The tools are not irrelevant for use in stable settings, and we would definitely encourage them to be used in disaster-prone regions or perhaps conflict-prone regions. As a kind of preventative or resilience measure. It's definitely beneficial in these vulnerable contexts to potentially train staff in advance to save time in the acute phase of an emergency. We can come back to talking about some of those sort of context-specific questions at the end, perhaps, if we have time.
Okay. Just going through here. There's some questions around available in other languages, and I think we can address those. There's interest in having it in Hindi. There are some questions around, do we have any case studies or lessons learned from using these tools?
Yes, so I just mentioned on that last slide very briefly that if you visit our website, there is a tab called case studies. And if you open that, it will kind of, we've come up with 5 simple questions that we've asked several of our users to answer. So that would be a good starting point to learn from the experiences of others. But if you're working in a particular context and you let the WashEm team know, we'd also be happy to connect you with others who've already tried the WashEm tools in your context.
Okay, we have a few more questions here that are coming in. I'm trying to triage them a little bit. One of the questions is, are the tools going to be updated after feedback are being applied in different contexts?
These are all great questions. You'll be pleased to know that the rapid assessment tools, as they appear on our website currently, are actually the 3rd version of the tools that we have released. Now, we are not making sort of fundamental changes to the tools each time we revise them, but the revisions are based on direct feedback from humanitarians. So the current versions we have on the website should be really the easiest ones to use so far.
Okay, I think we can answer some of these, because I think once you go through the software, it might be easier and answer some of these questions. If we're good to move on, keep posting your questions, those who are online. Some of them we will be answering in typing, so that we can try and address as many questions as possible. We're good to keep going? Great.
Okay, thanks, Olivier. So a key question coming up at this point is probably in relation to step 3 of the WashEm process. Why do we actually need a software to do program design for behavior change? And this is a very valid question. So let me start by giving you some of the reasons why I think it's necessary. So somewhere in most organization lies a bookshelf that looks a little bit like this one. It's probably full of dusty manuals that no one really reads anymore. And unfortunately, behavior change theorists are particularly bad for writing big, long manuals about behavior change that are really hard to apply and which never really reach the hands of those who could benefit from them most. So the advantage of a software compared to these hard copy type documents is that we can make the software available anywhere and at all levels of an organization. The software format also allows WashEm users to be guided through the WashEm design process. And so at any point, you are only seeing the minimum information that you need in order to use it. And this kind of masks the complexity of the behavior change task. We can all agree that doing behavior change is hard, but the process that we use doesn't need to be. So if you want to learn more at any point when you're using the WashEm process, we have intentionally built in links and it directs you to other resources if you want to read more, but that is kind of an optional choice that you as the user have. The next reason that I wanted to highlight why we might need the software is because I've actually worked on behavior change programs for many years now and across many countries. And the biggest challenge that I tend to see is that actually we're not terrible at taking time to understand behavior, but often we come back with these long reports with really interesting findings and no one really knows what to do with them. One of the hardest parts of behavior change is crossing this gap, moving from interesting findings and translating them into innovative program ideas. And because we struggle with that so often, what we tend to see is that hand washing programs in Bangladesh, for example, tend to look very similar to hand washing programs in Nigeria or Iraq, despite, of course, these contexts being very different and behavior being very different in these settings as well. And so the WashEm program design software is really developed to bridge this gap. So from the WashEm rapid assessment tools, you will generate insights about what is enabling or preventing hand washing in your setting. As you enter the results into the software will use evidence, use theory and practical experience from humanitarians, and it will generate activity recommendations that are context adapted for your setting. So that's a little bit of background, and now we get to kind of the more exciting bit. So I'm now going to open up the WashEm software, and you'll have to bear with me just as I quickly swap screens. Okay, so hopefully now in front of you, you can see the WashEm website.
Yes, yes.
Great. So this is your starting point for accessing the WashEm software and all WashEm resources. On the website, you'll find lots of news and updates. Here's the case studies link that I referred to just earlier. But what we want to do is click on Tools and Software. And this will take us to a new and separate window. And this itself is the WashEm software. So let's have a look at what we can see on this first landing page. First, you can see that I have actually logged on before. So you can see my little face and my name here in the corner. Now, if I was logging on for the first time, it's a pretty simple process. You would just type in your email, or at the moment, you can also use your Google account to log in quickly. Scrolling down, you'll see that we have two options here in the middle. One option is to learn more, and the other option is to get started. When we click on Learn More, it pushes us down the page a little bit. And here you can see an explanation of the steps involved in the WashEm process and an explanation of why you might want to use WashEm, as well as a direction back to the information site or to get started. Each one of these will take you through to the relevant links. So here you can jump straight to the Rapid Assessments page or to the Program Designer. But for the time being, let's go to Get Started. Under the Get Started page, you'll find the WashEm process explained in more detail. There's information about what each step entails, the time it takes, and links to key resources. So for example, you'll see here, you can again access the rapid assessments via this link, the training resources here, the program designer here, and further down, it will direct you to frequently asked questions or quick tips should you want to navigate that way. But what you will also see is this left-hand panel here. And this is really critical because it guides you through the WashEm process. So at any point, you can use this WashEm panel to navigate through the software. So let us jump to training resources. On this page, you'll find information about the training package and how to deliver it. If you scroll down to the bottom of the page, you'll find an option to download the materials, currently available in English, as I said, but coming soon in French and Spanish. You can also download the videos in relation to each method and also some training videos here via this link. The next tab down is about rapid assessments. So again, here we have an option to download the tools in either English, French, or Spanish, all of which are currently available. And when you download this, you get all 5 tools, and that's the guides for each tool. Plus you get the worksheets that you need for data collection, and you get the decision-making tables that will help you analyze the results. If you scroll further down the page, you'll get a brief explanation about each one of the rapid assessment tools, and you'll find a video that shows you how to do the method. So this applies for each one of the 5 tools. So now we get to the perhaps most exciting part, which is the Program Designer section. So when we click on Program Designer, we have 2 options. So the first option is to review the sample projects. So here we have 3 case studies, one from Lebanon, one from Zimbabwe, and one from Colombia. And we also have the option to start a new project. Now you can see here that I've actually already gone into the software before, and I started creating my own project based on data that I've perhaps recently collected. So I'm going to click continue to show you what the software looks like. So here we are first prompted to write in some descriptions about our project. So I've given my project a name. I've typed in flood response program. I've said that the country it's working in is in the Philippines. I have said that the area that I'm particularly focused in is in the north in a rural area. And I've told the software a little bit about who I am and designing this program. So my name, the organization I work for, and again, we have those same options like you used earlier in the poll to indicate what role we have. In the bottom here, this is a kind of optional section. We might want to add some information about when the data was collected or who it was collected by, or whatever you wish. Then we click Next, and that will take us through to the next tab. Again, we can look at this section on the left-hand panel to guide us through the WashEm process. And we can always tell where we are in that process at any one time. So you're now in the main WashEm questionnaire. And we will basically, if we're using this and entering live data, we would simply click or unclick any one of these boxes. So I said that this was a flood response program, so it is therefore a disaster. But you can also read underneath each one of these questions, and it will direct you as to how many answers you can select for any one question. So in relation to this general context question number 1, where we're talking about the type of emergency we are working in, it might also be the case in my setting that there is a disease outbreak during the flooding period as well. I would then move down, answering each question in turn. In my case, no, the population hasn't been displaced and they're still residing in their place of origin. So as you can see, these questions on this first page are related to general context. If you're unsure about the nature of the questions that are being asked, click the detailed instructions section and you'll get a bit of a broad overview about how to answer the questions. The next section in the WashEm software is in relation to constraints. So here you will be asked questions about the budget of your program, how long it is to be delivered for, the model of delivery that you'll be using, and also questions on security. The next sections in the WashEm software relate to the rapid assessment tools. So here you see 5 sections in relation to each one of the 5 tools. So again, you would go through and you would answer whichever whichever responses related to the data that you have collected. You might also find that one of the tools was inappropriate to use in your setting. So for example, for the personal histories tool, in the guide, you will see that there are some criteria for when you might choose to not use personal histories. And so in my setting, I've indeed not used the personal histories, and so I've just simply used the skip this section button at the top here, and this will mean that I don't have to answer any of the questions for this particular tool. Now, so basically, if you were filling this out for the data that you've just collected, you would move through each section chronologically, but you can also jump back and answer sections as necessary. Now, rather than sitting here and answering each one of those and then generating recommendations, I'm going to take you back to the main projects menu. And here I'm going to actually enter one of the case studies, which is about Lebanon. Now, the data in this case study is real data from Lebanon. It was collected in an urban area of Lebanon where Syrian refugees are living in informal settlements after fleeing conflict in their home country. So I'm going to click See Project Data. And again, we can see a brief description of the project here. If I scroll through, you'll see that we have all of the questions already answered. I actually can't change these because it is a sample case study, but you'll see that in each section, questions are answered. And so I'm going to jump straight to the recommendations button at the end here. So the recommendation section will always be presented according to how you deliver the different activities. You can see that some activities require infrastructural change, some require community engagement, such as a community event or mass media, some require household visits, and some are delivered through motivational stories. Looking through this list of recommendations, you'll see that each activity is described in a similar way. So you can see at the bottom of each activity card, so to speak, you can get an estimate of the relative cost of the activity, how easy it is, how long it takes to deliver, and whether you need any creative work to be done to design materials perhaps, or whether you need to procure anything. Also on this page, you'll notice that some activities may be highlighted as core activities. The purpose of this core activity notice is that if you are for some reason unable to implement all of the different activities that WashEm has recommended, we would suggest that you prioritize any that are highlighted as core activities. Now, if you want to know more detail about any one of these tools, you would click View. And this will open up a new panel where the activity will be described in more detail. So again, you've got this standard information across the top here, a simple sentence describing the activity, and below you have information about the objectives of the activity, what you will need to buy or procure in advance of doing the activity, and then step-by-step instructions for how you actually implement the activity when you get to the community. Right at the bottom, you'll find a tips section, which tells you how to basically advice on how to implement your activities well so that they have the desired effect. Let's have a look at one more example. I'm going to scroll down to the motivational stories recommendation. Here we have a recommendation to tell a story about big dreams. This is a story about a caring father who wants to do best for his children in a time of crisis. And here we have in this gray box an example of what the script should say for this story, but also when we go down to the tips section, there is specific guidance about how to adapt and modify this story so that it resonates with people in your context. Now, if we scroll right down to the bottom, we have broader tips for implementing your program. So some of these are specific to your recommendations, others are more general. And if you click down on any one of these, you'll see a short explanation of in relation to this topic, and it will also direct you sometimes to broader literature. So in this case, the example is advice on how to measure your behavior change program. So you might want to read through each one of these. At the end, you will also find a link to the quick tips. So let's click on that and find out more about that. In the quick tips section of the WashEm website, you will basically find a series of briefs. So here we have a brief on how evidence can be used to inform program design. We have a section with some advice on how to select WashEm participants, on how to do behavior change through changing infrastructure, like hand washing facilities, for example, how to monitor and evaluate your hand washing behavior change program. And most recently, we've done a short brief on how to do hand washing with soap in the context of the spread of coronavirus. We also have one more brief coming soon, which is related to how to budget for WashEm and how to write it into a funding proposal. So each one of these will take you to a downloadable PDF that you can also share with others, whether or not they are doing the WashEm process as well. Most of these exist as complementary documents, not necessarily something that you have to use just for WashEm. Now, if at any point during the WashEm process you have some questions or you're not quite sure of what to do next, you can jump to the frequently asked questions section. You'll find this on our website also. Here there are drop-down answers to simple questions that we often get asked. So it will also often link you to further resources. Now, if your question is, if you scroll down this list and your question that is a really burning question isn't listed anywhere here, we also recommend that you use this little chat box in the left-hand corner. So if you click on this, you'll have an opportunity to ask a question that you might be interested in. And then if you just press enter, we will try and get back to you as soon as possible. But if you go to the About page of the software, at the bottom of this, you will also find Oh, look, there's a quick response from Olivier. At the bottom of this, this About section, you will also find the contact information for how to reach out to WashEm via email. You'll find a link to our website, and above you'll find information on how WashEm was designed and how we have used evidence throughout the process. So I'm now going to switch back to the slide deck. Bear with me one moment.
Just a heads up, we have quite a few questions already that are coming in. I've been answering a lot of them in text, but I just wanted to give a heads up on that in terms of some of the verbal answers that will be lined up.
Okay, great. So at this point, you probably have some questions on how the WashEm software actually works. And whilst our team at CAWST have done a great job of making it look really simple, behind the software, there's been an awful lot of work. So as we kind of alluded to, in the WashEm questionnaire, there are 48 different multiple choice questions, and you have an option of 236 different responses to choose from. So every time you provide an answer and you click one of those orange circles, it uses a database of 800 rules about behavior and 28,000 lines of code to select from 80 different hand washing related activities. So in practice, what this means, I will show you just one quick example. Let's imagine that you have, we'll focus just narrowly on two simple questions. So question 23 in the software asks us whether in our context there is a specific place for hand washing in households. And we might find that in our context, there were no hand washing facilities. So if this was the case, the software would include activities like these ones here, such as improving hand washing facilities by providing materials, perhaps through a hygiene kit or a different modality, or creating a community competition to improve hand washing facilities. So it would include a range of activities all around improving infrastructure if this was your answer. However, it doesn't make sense for us to do all of these activities. So the software then looks to other questions in order to help exclude some of these. So for example, question 7 asks whether our target population get their infrastructure and products either from humanitarian organizations or if it is their own responsibility to purchase these products. And we might find that in our context, the population are typically responsible for buying their own hygiene products and building their own hand washing facilities. Now, if this is the case, that response would cause some of our options to be eliminated, and we would have just one recommendation related to infrastructure included in our results. And in this case, that would likely be creating a community competition to improve hand washing facilities. So that's a little bit about how WashEm works at a technical level, but I also now want to explain how it works at a behavioral level and what makes WashEm activities unique and perhaps different to what you've tried before. So as we covered earlier, one of the most common hygiene promotion approaches that we use is typically just teaching people about health benefits, but this rarely leads to behavior change. So actually, none of the 18 activities in WashEm are about teaching. Instead, we have 5 different types of activities built into the software. And if you go through any one set of recommendations, you'll normally see that they touch on different aspects of these. So some activities are focused on improving hand washing infrastructure to make it more desirable and easy to use. The second group of activities are designed to help populations think differently about hand washing behavior, and many of these activities involve powerful visual demonstrations which use props and games to create a moment of surprise or cause reevaluation of the behavior. The third group of activities try to motivate people to take action. So typically these activities involve making hand washing with soap seem more aspirational by telling a story. The last 2 groups of activities are designed to reward good behavior, because everyone likes to be told they're doing the right thing, and to position hand washing as a new norm. So now that we've gone through the WashEm software and you've seen a little bit what the WashEm activities look like, I would like to get a little bit more feedback from you all. So we're going to open up another poll, and here I want you to reflect on what the format of the activities looks like. By seeing examples like this one for glow germs on the right-hand side of the slide, do you feel that you would, that this has left you completely confused? Do you feel like you would need more guidance before you actually tried implementing these activities? Or do you feel that there is sufficient information on these activity guides to allow you to budget, plan, and implement these activities relatively easily? So we'll open the poll now.
So you can click on your screen and take your vote. So I apologize for some delays in some of the questions that you've been answering. I am triaging them, and we will have a time to answer as many of them as possible. And I'm removing the duplicate questions. And so just bear with us as we go through, and we'll be answering some of these questions. If we don't address your question online, these are all recorded, and we will get back to you. There's some great questions that are there. So we will get back to you at least by email if we can't address them today. Okay, we're going to end the poll.
Okay, so none of you are really confused, so that's really good news. So admittedly, these are quite new activities, so perhaps some people would still like more guidance, but the majority of you are saying that this is relatively easy to understand, which is great feedback. If you have ideas for how we could improve the format of these activities to provide that guidance, then please do let us know either by email or feedback in the chat box. Okay, let's keep going. I'm now going to hand over to Tom Heath from Action Contre la Femme, who's going to talk us through a case study of his use of the WashEm process in Nigeria.
So my name is Tom Heath. I'm going to talk about my experience using WashEm in Nigeria. I'm one of Action Against Hunger's technical advisors and have been the NGO focal point for WashEm. 3 years ago, at the beginning of this project, we knew we wanted to improve behavior change in emergencies, but we didn't know how we'd do that. I personally really struggled to envision how an expert engine would work, how the software would function. Yet today we have the rapid assessment tools, 800 rules, and some really great software ready for you. So ACF Nigeria, we're working in 27 camps in Borno in the northeast, and most of the people who've been in the camps have been there for around 4 years. I used an earlier version of the training materials to train 20 people. I took 1 day to familiarize myself with all of the materials, the different handouts, the different presentations, so that I could train my team. And then I took 2 days for the training, and that included the data collection. Now, not everyone who took part in the training used every tool, but everyone was involved in the data entry and the analysis from the tools. After the field work, the team were really positive about the rapid tools. They really felt that they dug into the realities of people's lives and that were more insightful than a lot of the standard packages that we use. So this was a big positive for me. In the photo, you can see the team in the process of analyzing a hand washing video. This is done together, and this process is a great way for the teams to understand the approach, to use the data and gain understanding of the populations that they're working with. A few of the results that we found from where we were doing this, we were looking at a large IDP camp of around 30,000 people. The people were generally worried about diarrhea. That hand washing was perceived to be associated with neatness, education, being a good parent, and looking attractive. That there was a strong sense that parents felt less able to provide for their children. That people are choosing to be less social, which may have been a consequence from being separated from their friends and family. And that hand washing had no dedicated space, and that the way people were practicing it did not appear to be convenient. And it's just a snapshot. So once we entered the data, we finished with 5 recommendations that I then piloted with the team. And the first were a set of recommendations linked to how do we increase the use of soap and get people to reevaluate it. Now, the software recommended an exercise using glitter to highlight the ease of transmission. If you look at the photo that's on the right of the gentleman, you can see these men who we've just approached and greeted with glitter on our hands. You can't see this in the photo, but the gentleman on his left touched his face just after we greeted him, and he has a very sparkly nose. And as a result of this discussion and this process, the gentlemen were much more engaged. And we use this as an opener to facilitate conversations with them about transmission and hand washing. And it turns out glitter is actually really difficult to get off your hands without soap. The second photo on the left is a bowl of pepper. And it's something that the software recommends is done best at the household level. And we entered into a household and we explained that the pepper represents germs. And we asked the person to dip their finger in the bowl, and the pepper sticks to their finger. And we put liquid soap on their finger, and then we put their finger back in the water. Now, it's quite impressive. The pepper, it flees from the finger. And it allows, again, a discussion that's much more engaged and much more dynamic because people can visually see the role of soap and how it's functioning. We're also working on radio drama that's using the motives and the information from the risk perceptions to develop the scripts. And we're working with a local creative agency, and there's advice on WashEm on how to do that. The last two set of activities that we're working on, we wanted to create the impression that everyone is hand washing. So we went around the camp and we found some people who've already created a locally adapted hand washing station. These three ladies all agreed to have their picture taken and for it to be published. And we created this banner which says, "I feel clean," recognizing our hand washing champions. And we're going to erect this billboard in the camp and produce a couple of other ones to kind of show people that there is a common practice of hand washing. Lastly, we're working to upgrade and improve our hand washing facilities outside the toilets that we're constructing, looking at how we can upgrade them with mirrors or with soap stands. Now, in terms of the overall WashEm experience, the ACF Nigeria staff found all of the tools really easy to do. They got people talking, they were much more engaging, and the activities were perceived as being more fun. There was just much more of a snappy dynamic after starting them. My team did need a little encouragement to trial the new ideas, but once they started them and saw how they worked, they were very quick to run with them and understand them. How I was working with the teams then was looking at how do we combine these 5 activities into a consolidated program, and how do I link this with what I'm currently doing. I'd really encourage you to download the training materials after this workshop and try it with your teams. Thanks.
Thanks, Tom, for that overview. Now, I was going to tell you about some of the broader implications of WashEm, but I'm actually going to quickly skip over these slides because I would like to make sure we have enough time for everyone's questions. So we can come back to this if people are interested. I wanted to, we're almost at the end, so we will open up for questions. I wanted to just flag the things that you can expect from WashEm over the coming months. So one thing that you can expect is after this webinar, you will receive a recorded copy of the webinar. And in this email, we will also include an Influencing Others pack. And in this, you'll find our new guide on budgeting for WashEm and writing it into a proposal. You'll also find a slide deck that you can use if you want to present WashEm to others in order to explain the process. And you'll find a quick flyer or pamphlet which provides an overview of WashEm. In the coming months, we would also, as Tom said, really encourage you to try out the WashEm process in your local contexts and to learn, and then we want to learn from you about what is working well and what we can improve. And as we have already mentioned, we really do take feedback seriously, and it will all be used to make further improvements to the software or other resources. Lastly, we wanted to flag one of the things that we have on the longer term horizon, which is our plan to roll out a WashEm Master Trainers course. So this is likely to be a week-long in-person certified course, which would allow you to be able to say that you can train others in the approach in your countries. So before we open up to questions, I'm hoping that this last idea caught your attention for some of you on the webinar. And I would just like to get a sense from you whether this is something that you think you might be interested in attending, or perhaps it's not you, but someone else from your organization should, or if this is not something that would appeal to you. So I'll just open the poll now.
Sorry, I just realized that one of the answer options are not there. So if it is someone from your organization, please just say yes. So as Sean's been presenting, I've been triaging a lot of the questions. And so we'll be going through them a little bit in groups of questions to make sure we can address as many as possible. Okay, I think most people have voted. So looks like there's a lot of people interested in there, and we will.
That's really great for us to know. We will be able to follow up with each of you individually about this and let you know our plans in relation to that master training course. Thanks very much. So as we move into our question session, I just wanted to leave this slide on the screen. So this is just to highlight again that when you're trying the WashEm process, you're not alone. You're welcome to reach out to us at any point via our website, via email. You can connect. You can set up a Skype call or other type of call with us. Reach out to us through the support hub. We have a pretty active social media page on both Facebook and Twitter, so please do follow us for news and examples from around the world. And if you're not already, please do sign up to our mailing list where we'll send out all of the major updates about the WashEm process.
Okay. So we're just going to put the videos back on so that you can see our face as we answer them. So if you should be able to see the list of answered questions if you want to scroll through them, but we will be repeating some of those orally. So just to get, so if we can keep the answers quite short so we can go through as many as possible. I have about 15 questions at this stage. One of the questions was really about, is this just focused on hand washing? Will it focus on other critical hygiene sort of behaviors?
So that is the most common question that we get asked. So good job there. WashEm is a hand washing specific tool. Now this is a strength and a limitation, I think. So of course your wash professionals, you're actually focusing not just on hand washing behavior, but on all aspects of wash. We do give you recommendations in the tips section of the activities as to how you can adapt some of the activities for other wash behaviors. You can also consider adapting some of the methods for other wash behaviors too. But really, the reason we have decided to focus just on hand washing is because it is a behavior that is relevant in every type of emergency. And because also it was a case study behavior for us. We wanted to prove that an approach like WashEm with rapid assessment tools and a decision-making software could work to aid behavior change. And I think we are still learning a lot from humanitarians before we would definitely want to try this with other behaviors.
Okay, thank you. There's a lot of question around the data collection. For example, is a barrier analysis required? How many people need interviewing? Can you use sort of COBO? So you could speak briefly about that and how that's done, or the difference that it is with other systems maybe.
Great. So each of the rapid assessment tools are quite different to other standard approaches that you might be familiar with. So I know that a lot of you typically collect data on tablets nowadays using open platforms like Kobo or others. That is not the case for WashEm in its current form. So WashEm very much is a participatory approach. It is qualitative. It is not a survey. And this allows us to use relatively small sample sizes in order to learn as much as we can from our diverse populations. So if you have more questions around the sampling for WashEm, then I suggest you go onto the software, have a look at that specific guide, which is about selecting WashEm participants. And there we explain more about the sample sizes for each method, how to choose people, and the rationale behind this.
Okay, there's a question around the data. When they do the, they put in the data, is it private? Does everyone see it? Can they share it? And what the plans are there?
So I know you didn't have a great deal of time to look through the questions, but what you perhaps will realize as you log on in the next few hours or whatever, is that none of the questions involve any entering of personalized data. So the step before answering those questions in the WashEm questionnaire online is to summarize the experience of people in your population. So you might work with several focus groups of participants, and in the end, you're answering the WashEm question based on the most common response across those different focus groups. So what results is that you're never entering in personalized data. And so any information that is entered into the software is completely anonymized.
Okay.
And just to add, most of the tools are taking maximum of maybe 30 minutes to do a tool. None of them are taking longer than this.
That's great. And so one maybe question for you as well, Tom. How long does it take to train the people on using WashEm, the tools I'm assuming the question is about?
I've trained people in a day when I was very familiar with what I wanted them to. I just wanted to get the data. For a longer training, we've done it over 2 days. I'd say most people are taking about 2 days with the data collection to go through. I mean, essentially, the training is just getting people to read the 5 guides with a little bit of additional guidance. And we're looking at what's the simplest way to do it. Once you know how to use the tools, it's very quick to do again. It's just that first, how do I understand the 5 tools? And they are very friendly to use. They're just participatory methods. They're not complicated. It's just understanding the different processes.
Okay, one of the questions is, I'll read it out. Some organizations respond to cholera and typhoid outbreaks each year. Can you undertake the survey in advance of a coming diarrheal disease outbreak to have your responses already?
Yes, you can. There are small adjustments that you need to make to one of the tools, specifically the personal history tool. There is a specific worksheet if you are working on outbreak preparedness rather than in an actual outbreak. So for those situations, please refer to the 4th worksheet of the personal histories tool. To give you an example, it was used like that in the context of Ebola in the Democratic Republic of Congo quite recently.
Great. One of the questions is a bit of the life cycle or the finite life of the WashEm project. The organization comes at an end, or the funding comes at an end. What's going to happen?
That's a very important question. So we are currently at a stage where we're actually looking for funding to support the last phase of WashEm, where we will focus on making the process really sustainable. But what we can promise is that the WashEm website, the WashEm software, and the support that users receive will continue beyond the life of the grant, and is something that will be managed between the organizations who are involved in WashEm. So you don't have to worry about it, expiring or losing access.
Right, and CAWST has committed to keep everything up online for the foreseeable future, at least 5 years from now, probably much more than that. But at least its current state, it will be available. One of the questions was around, would you recommend using WashEm to design handwashing activities for medium-term, sort of transitional aid projects, focus on specific settings like school, other institutions, and health centers?
I think it can be used at all stages of emergency response, so ranging from the acute to the much more protracted situation. Sometimes, listening to humanitarian actors, I hear people much more frustrated in the protracted stage than in the acute stage, because at the point where it's been sort of 4 or 5 years, the population is often really bored with the standard hygiene promotion approach. So WashEm can help kind of reinvigorate your program and adapt it. In terms of whether it should be used in other settings, such as schools and institutions, I think you can use WashEm for use among children or in school settings. If you're doing this, there is a question in the software which asks you to select for this, and you'll get more recommendations targeted at children. In relation to healthcare settings, we're currently not recommending that WashEm is used within health institutions. And that's simply because the determinants of hand washing behavior among healthcare workers are kind of influenced by a different set of determinants, partly because these people are sort of paid employees and they're in an institution. So we would recommend a different approach in those settings. If you want more guidance on how to work in healthcare settings, please do feel free to send us an email.
Okay, I'm just conscious of time. We are over the originally planned time, so we understand if you need to go. You will be getting a video, and we'll be answering some key questions. I think we might summarize a few answers in the email for the most relevant ones. We'll just cover a few more questions before we close. One of the questions was around the coronavirus. There's at least 5 or 6 questions around that, and sort of can WashEm be used, and what are we doing around that?
Well, obviously that is probably the most topical question right now. As you saw when I went into the software, we do have a brief specifically on coronavirus. You can also find this directly in the news section of our website or via our social media accounts. This brief that we have put together recommends that in the coming month, if you're planning hygiene promotion and hand washing promotion activities, you use a set of 5 tools, which we have clearly explained what the activities are and the steps and how easy it is to do and all of those things. And then in the longer term, if particularly your individual countries become more affected, then we would recommend using the rapid assessment tools, and we have given some guidance for how you can do that in the context of coronavirus. You will find if you navigate through the software that there is an option for, in terms of prioritizing which disease you're focusing on, you can click on a coronavirus option.
Great. We have one question a bit more about the list of activities. Can we download all the activities, or can we browse through some of the recommendations of various programs?
So currently the best way to get a sense of what some of the WashEm activities are like is to use those case study examples that are built into the software. So we have one from Lebanon, one from Zimbabwe, and one from Colombia, I think the other one is. And if you go to the recommendations page, you'll see how those activities differ by context, and you can navigate through all of those. We don't have a summary list of all of the activities at this stage. We might produce one, but we do want to encourage people to use the whole WashEm process in order to generate recommendations.
Okay, we have a lot of questions from Tom Russell. We will address those. They're great. Regarding a lot about sharing, how can we share? Or another one is around indicators. Do we recommend any indicators or evaluation activities regarding the recommendations?
So actually the question around sharing is really important, and I apologize for not going through that when we looked in the software. So there is an option in the software where you can click to export your activities as a PDF. Going forward, you know, in like 6 months or a year from now, we are hoping that you can easily virtually share your results as well. So we will be making that process easier, but sharing at the moment does happen through an exported PDF. Sorry, the second question there, Olivier,
was any indicators that can, or does the software recommend any indicators to evaluate the activities that are recommended?
So we do have a WashEm guide on how to monitor and evaluate your hand washing behavior change program. That covers both impact indicators and some recommendations for how to monitor the process of whether you implemented the program as intended. So do have a look through that. Again, if you've got questions, we're happy to respond to them.
One last one maybe is we can see in humanitarian interventions more and more cash and voucher activities. Is this included in the WashEm approach?
So one of the things that is very strong within WashEm is the idea that all of our activities need to help contribute to building and solidifying agency within the populations that we're working with. So I would say that there are a range of activities built into the software which allow people to kind of to choose their hand washing products, to customize their activities, and to just make humanitarian response a little bit more personal and a little less generic. Great,
I think we've addressed most of them, and so there are some variations that are left on there. but I do want to respect people's time, and we have committed to an hour. So I think we'll wrap it up here. If you do have any other questions, or if you want to repeat your question to us, we are happy to address them one-on-one. Please do send an email to support@washem.info, and we will get there.
Thanks a lot to all of you for joining and giving up your busy time. And do reach out to us and let us know how we can better support you.
And for those who couldn't speak English, there were a couple of French speaking. We will be doing another session later on, and we will certainly send out the invite. Thanks a lot for attending. Have a great morning, day, afternoon, or evening.
Thanks.